Do hair transplants work for scarring alopecia? I'm a board-certified dermatologist and director of hair restoration at UC Davis. Let's look at the evidence. For a long time, hair transplantation wasn't even considered for scarring alopecia. But over the past decade or so, multiple systematic reviews have shown that hair transplantation can be successful in carefully selected patients, especially when the disease has been quiet and stable and not progressing for a period of time. A large 2025 systematic review found that follicular unit graft survival, meaning that the hair transplant grafts that are transplanted actually continue to grow hair, that the graft survival is encouraging in the first year, often over 80%, meaning that 80% of the transplanted hairs survive and keep growing. While some graft loss can occur over time, even with non-scarring hair loss, many patients still maintain meaningful cosmetic improvement. Here are before and after photos from a scarring alopecia patient showing measurable improvement in transplanted areas up to 6 years after surgery, demonstrating that with stable disease and careful technique, meaningful cosmetic improvement is possible. So specifically, this patient had a lymphocytic scarring alopecia, and this is something that is very commonly diagnosed in my clinic. So to orient you, what we're looking at is the same patient, and to the far left are the baseline photos, and in the second column, you're looking at her post-transplant results 1 year after treatment. And then in the far right, you're looking at her post-transplant results 2 years after treatment. So you can see that she was able to have very good graft survival up to 2 years after her hair transplant. This is another patient that underwent hair transplantation. So what are we looking at? If you look at the top row going across, those are the baseline photos. So you can see this patch of scarring alopecia on the right and left temporal frontal hairline. On the bottom, you see her post-transplant photos, and they were taken actually 4 years after her procedure. And you can see that she maintained very good graft survival 4 years after the hair transplant. And this is a patient that actually continued taking her medications. Continuing to take your medications prescribed by your board-certified dermatologist for your hair loss is vital to maintaining optimum graft survival after hair transplantation if you have a diagnosis of scarring alopecia. So what makes success after hair transplantation most likely? What we've learned from multiple reviews is that success depends on thoughtful planning. Long-term disease stability, meaning that the scarring alopecia, whether it's lichen planopilaris or frontal fibrosing alopecia or something called central centrifugal cicatricial alopecia, those types of hair loss need to be stable for at least 6 months. So for me, my rule is a patient has to be stable actually for a year. So I try to make sure I give them extra time to stabilize on their medications. And then once they've been stable, they're taking their medication, they're not losing more and more hair, the hair is not getting thinner and thinner, and they're actually sometimes starting to get regrowth just on the medications. Once they've reached that point, then they become a great candidate for hair transplantation. And as long as they continue their medical management, they have a great chance for graft survival, meaning that the transplanted hairs continue to grow years after the hair transplant. So here's the hopeful takeaway. Hair transplantation is no longer off the table for scarring alopecia. With the right diagnosis, disease control, and an experienced dermatology-led transplant team, many patients can achieve meaningful, confidence-restoring results. So what do you do if you have hair thinning and you're not sure if you have scarring alopecia? See a board-certified dermatologist. Board-certified dermatologists, especially those who are specializing in hair loss, are specially trained to accurately diagnose hair loss. A lot of patients are out there who think they have a diagnosis of non-scarring androgenetic alopecia, but they might have very early scarring alopecia that mimics non-scarring alopecia. And if that's happening, then they might not experience the improvement on your standard treatments like a patient who truly has non-scarring alopecia. So if you're trying different treatments for your hair loss and they're not working, there could be a very early scarring alopecia, and it's critical to get an accurate diagnosis from a board-certified dermatologist who can actually perform a scalp biopsy to confirm your diagnosis. So then you can start your medical management, and then hopefully once you stabilize with your medical management, meaning that you stop losing hair and you hopefully start to regrow some hair over the course of a year, then you can become a great candidate for hair transplantation. Follow for more skin and hair restoration tips.